This is Dr. Giridharan, a practicing general surgeon for the past 33 years. I've been working in this Ashwini hospital, Mysore, as a senior most surgeon. I've been operating the anorectal problems for almost 33 years. Basically, I would like to enlighten about what are the problems one would face at the anorectal region. Like, anorectal region is a very important organ in any human beings. Well, we have so many problems. Many of the people would not like to expose themselves and come to a doctor and tell what exactly they have because of the fear, the shyness. But they'll be continuing to have lot of problems day in and out. The main concern with anorectal region is the hemorrhoids, fissure in ano, fistula in ano. These are the main things what one would face in their lifetime. There are various reasons to have bleeding per rectum, what we call we bleed through rectum. There are various reasons for that. The main reason is piles, what we call the general terminology, we call it as piles. It's called hemorrhoids otherwise. We have fissure in ano, we have fistula in ano, and the symptoms vary from each and every condition. There are various reasons where you have bleeding per rectum. The main problem with bleeding rectum is hemorrhoids. There are various other conditions where you will have bleeding per rectum, like you have some liver problems, you have some growth in the rectum. Even during fissure also sometimes we have bleed. But a doctor is the right person to identify what actual problem you have. In a piles, you have bleeding initially. Why does this bleeding occurs? What is piles and what is hemorrhoids? Hemorrhoids is nothing but the engorgement of the blood vessels at the anorectal region. Why does that occur? It occurs mainly because of the pressure what we give. God has created human beings where our posture is straight. We put all the pressure right at the anorectal junction when you strain. But whereas animals, they don't have these piles because of their posture. The pressure doesn't fall onto that. So one of the main reason is when you have lot of constipation and your bowel habits are not normal and you put too much of pressure, and this constant pressure, when you keep on giving constant pressure, the blood vessel starts engorging and it is lined only by the mucous membrane, and some time or the other, because of the hard stools, when you give so much of pressure, these blood vessels open up, they start bleeding. So during hemorrhoids, what happens is, when you go to the toilet, when you put too much of strain while passing motion, that gives way. So initially, even before the stool passes, the splash of blood will be there on the commode. It's a very scary situation for anybody to see. You should not panic for that. You should also complain to the doctor immediately so that it will be attended when it is initial stage itself. The disease, when it's not progress, it is easy to cure also. So when we look into it, we have different degrees in this hemorrhoids itself. There's degree 1, 2, 3 and 4. When it prolapses outside totally, when it cannot go inside, that leads to so many other complications also, like that piles can get infected, they can get thrombosed, the blood can get clotted in that, and sometimes that also gets infected. Then it adds to multiple problems. So I would suggest you get this treatment when it is in stage 1 itself. It gets cured very soon. This is the basics about hemorrhoids. Then later on, what is fissure in ano? Fissure is nothing but when the sphincter, we have that control of passing motion, where you can control sometimes. When you have a constipation, when you try to control too much, this gives way, or in the front or at the back. When it gives way, it forms an ulcer. It tears. When it tears, you have this ulcer, and it keeps on going on and gets infected. When it gets infected, the pain occurs. In hemorrhoids, you will not have much pain unless you have some complications. But whereas in fissure, you have lot of pains, so you have a fear of not passing motion. So what happens, it's a vicious circle. When you not pass motion, it gets constipated, and you try to push more, then again this pain is going to increase, and it increases the size of this fissure. So what you should do is, when there is a spasm of the fissure, you have to get that operated as soon as possible. Then regarding the fistula in ano, fistula is nothing but there's a connection between the rectum, the mucosa, and to the outside of the skin surrounding the anus region. So that forms a tract, because the anal glands gets infected in fistula and ano. When the anal glands get infected, so the pus has to come out somehow. So to come out, it makes its own passage. So when it makes its own passage, it comes out through the skin and making an artificial opening there. And if it is not treated properly, it tries to make multiple passages, and you get multiple openings, and you'll start pouring pus in from all the openings. And this also, as I tell you, it has to be treated when it is in the initial stage itself. So these are the main 3 conditions what we come across in anorectal region. So how do you go about this? Well, there used to be many modalities of treatment right from the beginning. We used to it was an open surgeries for hemorrhoids. We used to cut open and tie it up, and the patient has to stay for 4 or 5 days initially. There used to be a lot of pain. They used to be under anesthesia. But later on, they had some banding technology who had come. Then there was a cryotechnology. But all this had some limitations. The patient has to stay in the hospital. The pain following the surgery, early ambulation was not possible during these procedures. But since 5 years, the newer technology has come, which is called the laser technology. It's a wonderful technology, wonderful instrument, where the patient can just walk in, and it's a daycare procedure. Not much of anesthesia is required. Hemorrhoids, what we do is, you just have a fiber. Through the fiber, we will be coagulating all these blood vessels, which causes this bleeding. So what happens? It shrinks the hemorrhoidal mass. So you need not have to have a cut, and you need not have to undergo a major surgery. And the early ambulation, you can walk in and walk out. You can go to your work the very next day. There ends the problem, and the later on complications also will not be much, and the cost of the surgery also will not be much. This is what we do in hemorrhoids. But whereas in fissure there is an ulcer already. If it's a very big ulcer, we just cut it across through the laser itself. And as I told you earlier, there is a sphincter spasm, where the anal region, there is such a big spasm is there. So you have to relieve that. The muscle is gone in for a spasm where it will not let loose and allow the motion to pass. In such scenario, what you do is, you just cut open the fibers just through the laser itself. That relaxes your anal region. Once it relaxes, it will be an easy thing for it to pass motion, and the later on complications will not occur. This is another procedure. Before, we used to open and let the ulcer to heal by itself. That would take again a week or 10 days and that will dislodge your work also, and so much of tensions and the cost of the medicines, you will not be able to sit properly. But whereas here in laser, you will be able to sit, you can drive your vehicle, so it's easy. Then when coming to the fistula in ano, fistula, as I told you, it is a tract which from the rectum to the skin outside the perianal region that's around the anus. But here what happens, in the regular surgery, what we used to do is we used to cut across the tract right up till the opening of the rectum and lay it open for it to heal. Imagine, it will be such a big wound in your perianal region, and you will not be able to sit, you will not be able to pass motion properly with lot of pain, and that would take sometimes 1 month to 1.5 months to heal. But this new technology of laser, it's a wonderful procedure. What we do is we just tie up the internal opening, and the remaining tract we burn it, or what you call is coagulate that tract. Later on the fibrosis occur that closes the tract. So ultimately you will not have an open wound, and you'll be able to go to job the very next day. It's a wonderful procedure. Here the failure rate is very less. It's only about 5 to 6% of failure rate if this procedure is adapted. But this procedure has little bit of limitations. If it's a very high anal fistula, the recurrence rate will be little bit more when compared to the low fistula and ano. So this is all about the anorectal conditions. Then when you come to the pilonidal, I just want to talk about the pilonidal sinus. Pilonidal sinus is a sinus where, because of the air, the skin, there is indrawing of the skin inside the subcutaneous region, and inside the skin there will be bunch of hair particles which go inside, and that gets infected. When that gets infected, that keeps on pouring pus. This usually occurs at the intergluteal region, that is in between the buttock region, where airy skin patient are known to have this condition unless you trim your hair properly and you don't take care of your perianal region and your intergluteal, what we call as that region. If it's not taken care properly, this condition occurs, that gets infected. Initially what we would do, we used to lay open the tract and remove all this air particles which was infected, and all the granulation, the infected material, we used to scoop out and lay that open and let it heal by secondary intention. But whereas in a laser technology, we just probe the tract, remove whatever the dead materials like the granulation tissue and the air particles, and then just close the tract by giving this laser energy source where it coagulates, and fibrosis later on occurs and closes the tract without any problem. This also is a day care procedure where you will not have much pain, so you will be able to get back to the work without any problem. So don't you think this laser technology is doing wonders in our medical field? Yes, definitely. And I have been doing this surgery for quite some time now, and we are facing a lot of good success, and people are very happy regarding this modality of treatment. I would advise the people who are really suffering with this disease to come forward and get the things and get the benefit of this laser technology. Thank you.